Dear Chairman, colleagues, thank you for your invitation. Let me start our presentation about interventional treatment of patients with coarctation of aorta. We stenting of aorta in 61 patients. Coarctation of aorta was in 38 patients and recoarctation of aorta was in 23 patients. 41 patients was male and 20 patients was female. In 90 patients was isolated coarctation of aorta and coarctation aorta associated with other different defects was in 19 patients too. Recoarctation of aorta isolated was in 13 patients and recoarctation of aorta associated with other cardiovascular defects was in 10 patients. 11 patients with recoarctation of aorta was after balloon angioplasty, 9 patients was after surgery, and 3 patients was after surgery and balloon angioplasty. In our country, we use angiography classification by Shahov-Sharablin. They consider 4 angiography type coarctation of aorta. The first type characterizes local restriction of aortic isthmus. If you see this angiographic type, you may use balloon angioplasty or stenting. Type 2A, local restriction with anterior with minor deviation of aorta. You use balloon angioplasty or stenting in these patients. Type 2B, local restriction and deviation of aorta larger than type 2A. If you see this type angiographic, you use only stent. Type 3, local restriction with post-stenotic dilatation. You use only stenting these patients. And type 4, hypoplasia with tubular stenosis. We use cover stent in these patients. We stenting 61 patients. In all our cases, we use Mullins or Arrow delivery system, BIB, ZMED or Mullins balloon catheter, and implants Palmats, CP or cover CP stents. This slide presents the stage of stent implantation in patient with coarctation of aorta. At first, we make angiography, then we use balloon catheter BIB, positioning stent, and inflated inner balloon, outer balloon, and control results. And this slide presents our experience in treatment patients with recoarctation of aorta before and after. And these patients with coarctation of aorta, bicuspid aortic valve, and aneurysm of ascending aorta. The first stage, we implantation the stent, then cardiovascular surgery, aortic valve replacement, and prosthesis ascending of aorta. Immediate results was good in 59 patients. 2 patients had satisfactory results. Aortic gradient blood pressure in all our patients decreased from 50 to 2 millimeters. We have 5 complications. In 3 cases, we had stent dislocation, and in 2 cases, we had a femoral artery thrombosis. And this slide, you can see dislocation of stent during the procedure. When we inflated balloon catheter, the stent jumped into the descending of aorta, and we use the second stent implantation. Long-term results was good in 34 patients, and 1 patient had no satisfactory results. You see the young man, the young boy with coarctation aorta type 1. We use the stent. Gradient blood pressure decrease from 47 to 0 millimeters, but 13 months later, we had paracaortic aneurysm, and we use the stent graft Valiant Medtronic. It's a final result. And conclusion, the endovascular methods of treatment can be used with success in patients with coarctation and recoarctation of aorta. Good immediate results after stenting were in 96% patients. The stenting of aortic isthmus can be successfully used for the correction of different types of coarctation of aorta, and in some cases, stenting of coarctation aorta is an alternative to open surgical interventions. Thank you for your attention.
What about rate of restenosis in the patients where you did stenting?
After procedure, we don't have restenosis in our stents.
No stenosis?
No restenosis.
On over follow-up is for how long?
What?
Follow-up. Mean follow-up is how much?
Follow-up, 5 years.
What would be your indication for doing an open surgical intervention?
Excuse me.
What would make you want to do this by open surgery rather than angioplasty?
When there is indication for open surgery instead of angioplasty.
Mr. Chairman, if there aren't any questions, we'll move on to the next presentation.
Okay.
I think we can.
Okay. Thank you very much.